Program Management in Early Childhood Education. We have previously discussed the many roles you play in fostering children's development. Guiding their growth and learning is, of course, your primary responsibility as an early childhood educator. However, you also play a leadership role within your environment to ensure your program runs successfully. Even though center-based educators have supervisors and administrators, there are still many management-related tasks that must be carried out. These include observation, documentation, and planning. In fact, family child care providers are responsible for all management activities, including tasks beyond the scope of this chapter, such as financial operations. To teach effectively, you must regularly manage your time, space, and resources, and maintain accurate and updated records, similar to the responsibilities administrators have in a workplace to ensure efficiency. In this section, we will explore the administrative tasks early childhood educators must perform to work effectively with young children: assessing through observation, documenting children's learning, planning and evaluating, keeping records, collaborating with colleagues and the community. Let's clarify some key terms used in this section. Accountability is being responsible to funders, taxpayers, policymakers, and families by offering a high-quality program that supports children's development and learning. Assessment is tracking what children know and can do, usually through tests that measure their progress towards set benchmarks during specific time periods. Results are often used to evaluate program and educator success. Authentic assessment is gathering information from multiple real-life sources over time, organizing and interpreting this data to plan an effective program. Documentation is collecting data, evidence, and items to tell the story and purpose of an event, experience, or project. It informs about individual children, the group, and teaching effectiveness. Observation is accurately and objectively recording actions, behaviors, facial expressions, body language, gestures, babbling, and speech. These records are used to plan for individuals and groups. Assessing through observation. Assessment is a vital part of teaching. You set goals, plan your program, and implement your plans. Then, to evaluate your success, you assess the program's effectiveness, both formally and informally. There are 6 main purposes for assessment in early childhood programs. 1. To support learning and development. 2. To identify developmental delays or disabilities. 3. To evaluate program effectiveness. 4. To monitor trends and needs. To measure children's progress for accountability. 6. To advance knowledge of child development. As an educator, you will participate in all 6 types of assessment, but your daily priority is the first one: to assess regularly so you can adjust teaching to meet the children's documented needs. Standardized testing versus authentic assessment. Traditional standardized testing has largely been dismissed in early childhood education. These tests are not developmentally appropriate, as young children often can't understand verbal instructions, multi-step directions, or auditory cues. Their responses may be influenced by fatigue, hunger, illness, boredom, or anxiety. As a result, the field has shifted to authentic assessment, a process that relies on multiple forms of evidence collected over time. Many experts argue that authentic assessment should be systematic, where information is gathered for a specific purpose, using consistent, unbiased methods; naturalistic, where observations occur in the child's regular environment, like a classroom or home care; routine-based, where data is collected during daily routines, play, meals, transitions, etc. Educators use authentic assessment to guide and personalize curriculum planning to each child's strengths, needs, and interests. The most common and essential form of authentic assessment is systematic observation, conducted frequently and consistently. These observations help identify typical and atypical behaviors. You should record and reflect on what you see to inform your future teaching practices. Examples include informal observations, such as noting when 6-month-old Mikey sits up for the first time, or when 3-year-old Natasha shares her favorite doll. These moments should be recorded with a date for family sharing and instructional planning. Formal observations are used in program-wide assessments, like checking if 2-year-old Armando can follow 2-step directions during lunch by asking him to clean his plate and wash his hands. Use a checklist and write comments on what occurred. Observation is essential, but only effective if it's intentional. For example, today you might notice that children are unusually restless and avoiding the dramatic play area. Could it be the rainy weather keeping them indoors? Or has the dramatic play area become stale due to lack of new materials? As Jablon, Dembrow, and Dichtelmiller, 2007, wrote in The Power of Observation, observation is watching to learn. Define what you want to learn and observe at the right times and places. For instance, if you're interested in children's transitions, observe during drop-off or pickup to see how they say goodbye. Taking the time to watch what's happening in your classroom helps you plan an effective curriculum. Observations help answer, how do I use the environment to support routines and activities? Are quiet and noisy areas separated? Do babies have space away from mobile toddlers? Are materials inviting, accessible, and developmentally appropriate? Are group spaces well used? Do children follow the daily schedule? Does the program welcome families and provide comfortable transition spaces? Does the outdoor area support whole child development, physical, emotional, cognitive, and social? How is inclusion supported for children with disabilities? By reflecting on these questions, you will better understand how your environment and teaching practices support or hinder child development and learning.